And the medical world has changed so drastically. I mean, doctors shake your hands and the nurse takes your blood pressure, and that's about it.
I really think a lot of patients feel like they've been on their own because there's just not that proactive reach out, and so you can easily fall through the cracks.
But a team at Sutter Health made sure that didn't happen to Mary Campbell after she left the hospital.
Darren called me at 8 o'clock that morning, and I thought, well, somebody cares.
I think at first, a lot of patients are surprised getting a call right after a hospital or emergency room visit. They're a little shocked that we know that they were there.
As a case manager, Darren Giberson coordinates care through an innovative approach at Sutter Health called the Patient-Centered Medical Home. In addition to physicians and medical assistants, case managers work side by side with a triage nurse, social worker, and a pharmacist to provide seamless care in a single location, the office of the patient's primary care doctor.
Patient-centered medical home is a different model in that it is more proactive in the patient's care, meaning that we are, as the office, reaching out to patients.
One of the things we fear after ER discharge is something called a bounce back. In other words, patients return rather quickly to the ER or the hospital, which cause, of course, problems for our healthcare system, not to mention the impact to the patient's health and their care. Mary was probably not planning to see me back if it wasn't for one of our partners here, Darren.
She didn't think there was really anything that we could do for her that would change anything. It was great that when she did come in to see the doctor, that he introduced her to me and found out there was really a couple more things we could do to maybe optimize her medications. We didn't just take into account only the disease, we took into account her quality of life.
Her symptoms have improved. She's no longer really short of breath. She was actually on her way to a cardiologist appointment when I last spoke with her. I think the last thing she said was, "You've made a great difference in my life."
I know what's happening to me, to my body now. Now there's a team here. I feel so much more cared for. It's just a nice feeling.